A subspecialty in orthopedics is orthopedic oncology, which is evaluation and treatment of tumors of the bone and soft tissue, and tumor-like conditions, most of which aren't tumors. But that's just a portion of what I do, and luckily it's a small portion, because you don't want to have anybody have that problem. A great portion of what I do is what's called general orthopedics, which is pretty much everything else. So I'll tell you this story. It's interesting. I was 14 years old and I injured my knee, and it was really bothering me. My dad took me to see an orthopedist, again in Manhattan, one of the big wigs, who he knew from the hospital he worked in. So I went to see the guy. He came in, he examined me, and he said, "Kid, you got a cartilage tear. You want an operation or not?" And I said, "Well, what are we talking about?" He said, "You know, an operation. We cut you and I make you better." And I must have taken a little long to answer, and he said, "Well, look, you think about it. When you decide, you call me. If not, live with it." And I looked at my dad and I said, "Dad, I know he's a very good doctor, but he's an idiot." And I kind of decided at that time that there must have been a better way of doing it. So that got me interested in my own injury, which I found out a bit about. And just the whole way of medicine at that time was done, and I just got hooked. People come to the doctor because they have a problem of some sort or another, and you know, it falls on us to try to work out what it might be, what's going on, and what best to do for it. My real philosophy about how to be a doctor is to try to figure out how to get to the best endpoint in the easiest possible way. You can really see people come in and have true changes in their life. You know, saw a woman came up from Georgia a few months ago. Why nobody took care of her down in Georgia, I don't know, but it seemed that it was a pretty straightforward problem with her. She had a very bad hip. And it seemed a surprise to her when I told her, you know, we can fix that. It's going to take an operation, but we can fix that. And I didn't recognize her when she came back because I had only seen her in her wheelchair up until that point. But after the surgery, she comes walking into the office. She was a completely different person. Personality was changed, outlook was changed, and for the first time in the longest time, she was out of pain. If I could do that with everybody, that'd be perfect.